Again, going with the M, what matters the most to our patients, this is going to really affect their quality of life. And I find as a geriatrician working in the community of New York, many, and probably in most places, our older individuals want to stay in the community as long as possible. They want to be independent, they want to live their lives, they want to function as they did previously, as much as they're able to in society. And it's important to, in order for us to allow our older patients, very deserving persons, to have this highest quality of life, we really need to, as geriatricians and as primary care supports and all those who take care of older persons, which basically is everyone, we need to reorganize the whole social structure, the financial piece, the working piece. Basically every aspect of society needs to flex a little bit in order to maintain this, because this is something that is not going away. We have more persons who are getting older. We need to build on this momentum and keep it going. Quality of life can be physical, but it can also be very much mental. So the idea of aging as a negative form, which is often the connotation, is that we need to move away from that. We need to promote aging as a process that everybody experiences, and this is something that we need to be creative in our society and come up with ways to help with our older individuals, keep them at home. If they need to go out and they need transportation because they can no longer drive, we get that transportation service. Some of you may or may not know that many of these transportation services are starting to use, for example, robocalling to call the person and let them know the car has arrived outside. So if you can imagine technology also being a barrier, learning how to use or respond to an automated call can be challenging. So kind of figuring out ways, like that's one example, but coming up with ways to help with navigating the community, for example, transportation-wise, getting nutrition into the home if they're unable to go outside, having supports, pharmacies to support them medication-wise. These are things that can help maintain the highest quality of life in that particular social aspect. Caregivers at home, this is another aspect that we have big deficits in the United States. Previously, the most common demographic, the type of caregiver, was a woman between the ages of 25 to 45 who would stay at home and help take care of this older person. Nowadays in this country, women of this age group are actually doing other things. There are more opportunities for women to do other things, therefore leave this gap, this caregiver gap. Who is stepping in to take care of, take over this gap? And so caregivers that are becoming caregivers may be people who are outside of this demographic, so not women, not ages 25 to 45, who are trying to fill this role and they may not be prepared. They may not have thought that they were going to do this. They may feel resentment, they may feel guilt, and they're just ill-prepared to take this on. So we, in order to maintain high quality of life for older persons who might need caregivers, need to also reinforce this caregiver workforce and help meet this demand, this very necessary demand for our older population. There are a lot of new technologies that exist to help monitor persons. It is tricky to figure out which ones are the best, comparing them because there are so many that come in and out. And it's hard as a geriatrician to keep track of all these things that come out. It really is a good discussion to have with your patient in front of you, seeing how much access do they have to other people if they need to have this monitoring. Perhaps a device on their wrist or some kind of emergency call button would be the best. If they have both, or if they feel comfortable, they know how to use these kinds of technologies, this could be an extra asset. Some may feel that this is too much, so it's really something that you would have, and perhaps part of your advanced care discussion, your advanced care planning. But this can be part of helping our older individuals maintain their independence for longer in the community, which could be what matters the most to them.